Hi, my name is Anna Dolopo. I'm a licensed acupuncturist, and my business is Elements in Harmony Acupuncture and Chinese Herbs. I practice in beautiful Laguna Hills in Southern California. I've been in practice since 1999, and I've been a Dr. Tan's Balance Method practitioner since March 2006. Today is our 25th YouTube video, and we are going to talk about labor and delivery. Many women who are coming here pregnant, I had helped get pregnant naturally. And I discussed many of those cases, or a few of those cases actually, in my 5 YouTube videos. You might want to watch those, especially if you want to get pregnant naturally. And there are many women who come in here who had gotten pregnant before they had come to see me, and they want me to help them keep a very healthy pregnancy. Or they might be breech, the baby might be breech. I've turned 7 breech babies. And let's see, I help a lot of women with placenta previa. One who is here right now as we speak, and she had full placenta previa. It was complete placenta previa, and now she doesn't have it anymore, and her doctor is confident that she can have her 5th baby vaginally. And that is a huge feat, because they weren't sure about being able to do a vaginal birth, considering that the placenta previa was complete. So there are many women come in here with all kinds of high-risk pregnancies, and they're always being monitored by their doctors. They may be on bed rest, and acupuncture is something that, when done properly, can really help a woman have a very strong and healthy pregnancy and keep mommy and baby very happy. So today I'm just going to read from a few testimonials and letters from some patients. And today I had received one from a woman. We'll call her T. She just delivered yesterday, and she emailed me today. So testimonials, this is under labor and delivery in on my website. So here's the first one. I also visit, and some of these are testimonials that also are regarding their natural pregnancies that I helped them with. I'm going to leave that part of the email out, just so we can keep the letters brief. This one is part of a letter. I also visited Anna right before going into labor for helping in induced labor. I was 3 days past my due date when I visited her for a treatment and went into labor the following day and had my baby girl that evening, Edie, 9 pounds, 5 ounces, and 22 inches. Anna is incredible at what she does, and also very informative, knowledgeable, and supportive throughout my pregnancy. Thank you. Edie's mom had come in to get pregnant naturally, which she did. This second one is also part of a letter of a woman who I had helped get pregnant naturally. And this woman, S, she also came in for induction. My pregnancy was virtually problem-free, with the exception of having typical pregnancy symptoms. In my 40th week, I went to see Anna for natural induction because I was scheduled to be induced in my 41st week. As expected, it worked. 2 days before my induction, my water broke and I went into natural labor. Today I sit here with my beautiful 9-week-old baby girl, and I get misty-eyed just thinking about the road to getting it. I always refer to Anna as my angel, because without her, I would not be in this fortunate place. Thank you, Anna, for making my dreams of being a mother come true. S's baby, L, is now 11 months old. This is part of a letter from a woman that I also had helped get pregnant naturally. I noticed a few things in the hospital that I feel all of the acupuncture visits helped with. This particular woman had seen me for 7 months before she got pregnant naturally. They had tried for 2 years, which included Western fertility drugs. Okay. So back to the letter. I was at 5 centimeters before I knew I was in labor. I only pushed for 30 minutes, and although I chose to have an epidural, I was up walking around an hour after birth. The healing process to my body was quick, and I only took pain medication for 2 days after birth. I should mention that the nurses were surprised. They actually were amazed by this. It was also a miracle that I didn't have to have a C-section, considering how premature my labor was. This particular patient, L, she's the only one who actually went into labor a couple of months before her actual due date. So all of my moms went full term. This is the only woman who did not go to full term. I believe that with lots of prayer and the help of Anna, we were able to have the gift of a child. Thank you, Anna, for walking through this adventure with us. Blessing always, KL. All right, this one is actually a letter for only labor and delivery. Hi, Anna. When I came in to see you, I was getting cramping. After the treatment, the cramps increased. I started tracking my contractions at 9 p.m. when they got really strong. I labored all night trying to get rest and sleep in between contractions. They were 10 minutes to 20 minutes apart for a long time. I started to get worried at 9 a.m. when they were still 10 minutes apart, but they did increase in strength. I then had to get out of the house to clear my head. When I got back home, my contractions went to 4 minutes apart in an hour. We went to the hospital and I had Lincoln in 1 hour and 45 minutes. The end was quick. I gave birth at 1:15 p.m. on March 6. I didn't use an epidural. I was very happy with the birth experience. It was 16 hours of labor, but it didn't feel long at all. My first birth experience lasted days, so maybe that is why too. And Shelly, she's referring to Shelly Goodfriend, a doula, a lactation consultant, and she happens to be my energy healer, and she also is a mother of 5. Shelly was amazing. Couldn't have done it without her. Thank you so much for getting the labor going. It is hard to know, but I think the treatment sped up the length of the labor too. Thank you, Shayna. Shelly Goodfriend can be contacted for her services as a doula. Please let me know if you would like to contact Shelly. This is another letter from a patient who came in specifically for labor and delivery. At 39 weeks, my OB wanted to induce labor, claiming she thought the baby was too large. I was able to hold her off until 39 weeks and 5 days. The OB had scheduled for me to be induced Monday morning, so I went to see Anna on Thursday night. I left at 8:30 p.m. after the first treatment, and contraction started at 9 p.m. Our son came before 9 a.m. the next day. All the more amazing because our first child was 11 days late with a 46-hour labor. After working with Anna, Owen was 2 days early and born in less than 7 hours from having had the treatment. Thank you, Anna. Jen Morgan.